Hello. Today let's talk about diabetic foot reconstruction. Diabetes can lead to a condition called diabetic foot, which is characterized by neuropathy, that is nerve damage, and peripheral vascular disease, that is poor blood circulation, especially in the lower extremities. These conditions can result in diabetic foot infections and deformities. Diabetic foot reconstruction refers to the surgical procedures and interventions aimed at managing and treating foot complications associated with diabetes. Essential causes of formation of ulcer in the feet of diabetes are poor circulation, poor sensation, infection, trauma, and uncontrolled diabetes. What are the concerns of these on the feet? These above reasons can present as calluses or thickening of tissue, foot ulcers, blackening of the toes or gangrene, swelling of the foot, pain in the foot with fever, and deformed foot. When the above are uncontrolled, patient can present in a state of shock due to uncontrolled infection called septic shock, where patient may have high temperatures, fall in BP, and reduced urine output, which is actually a very serious condition, and the patient will need hospitalization in an ICU setup. Investigations required to assess the state of ulcer and diabetes are blood tests for sugar and kidney and heart function, sending pus or infected tissue for culture to start suitable antibiotics, X-ray of the foot to see the skeletal system, that is bone infection, bony instability, etc. Doppler examination of the lower limb to assess blood circulation in the lower limbs. Principles of treatment of a diabetic foot ulcer are essentially to improve the blood flow, to control wound infection, and to manage the sugar levels. So the first aspect of treatment is revascularization, or to improve the circulation in the lower limbs. To improve blood flow is a fundamental requirement in diabetic feet. This is done by a vascular surgeon or an interventional radiologist, and the procedure is called a peripheral angiography and angioplasty. By angioplasty, the narrowed blood vessels are opened up so as to improve the blood flow through the vessels of the lower limb, which is essential for any kind of wound healing. The second aspect of treatment is debridement. This is the first surgical procedure for any diabetic ulcer, that is, to remove all dead and infected material thoroughly. Often this has to be repeated twice or thrice to get rid of all infection. Once done, the wound will then enter a healing phase. Repeated dressings are then required before a reconstruction is planned. The third aspect of management is osteotomies and joint reconstruction. If indicated, bony correction is done by a foot specialist. Lastly, soft tissue reconstruction. This is done by a plastic surgeon. Here the wound is covered with a skin graft or a flap. If the blood supply to the foot is good, then a free flap is planned, wherein tissue is taken from the thigh or from elsewhere and transferred to the foot using microvascular anastomosis. This new tissue covers the entire wound on the foot and heals up the wound. Subsequently, patient starts to ambulate with protective footwear. Now let's look at the post-operative care of diabetic foot reconstruction. Suitable footwear is customized for the reconstructed foot. Gait training is provided. If there are loss of any toes, then prosthetic toes can also be made to complete the reconstruction of the foot. In this way, diabetic foot can be salvaged, and from amputation we move on to ambulation.